NERCHA Director Khanya Mabuza says the number of people dying as a result of HIV/AIDS between 2013 and 2016 has decreased, but the number of people living with HIV between the same period has decreased. Mabuza says the increase in the number of people living with HIV is as a result of people who are HIV positive are no longer dying since they are on antiretroviral treatment. Our news reporter Sibusiso Ngubane is coming to us from a Sibayeni Lodge in Matsapa.
The director of NERCHA Khanya Mabuza commended Parliament for working with his organization in coming up with a strategic plan which will take the country to an AIDS-free Swaziland. Mabuza says it transpired during their discussions that the negativity about HIV and AIDS probably needs to be repositioned, as there is a lot that the country has done and there is a very impressive progress. He says together with the parliamentarians, they looked at AIDS in 2013 and 2016 as to what has happened in terms of resources spent and the outcomes thereof.
There has been a drop from around 4,000 deaths per year to about 3,000 deaths a year. And then to avert one death for HIV/AIDS, we actually understood it to be very, very difficult. So here we appreciated through your office, the Right Honourable Prime Minister, that we are seeing progress when it comes to this. And then bad good news depends where one stands. We also look at the number of people living with HIV. Here we recognize that the number of people living with HIV is going up. Because I don't have much time, we agreed after much debate, Your Excellency, and we're asking why are these numbers going up and so forth. But the agreement and members thought were involved, and I want to appreciate the sectional committees on HIV and committees on health and other committees. But it was agreed, in essence, that the numbers are going up because we are not allowing people who are living with HIV to die.
The chairperson of the HIV Sessional Committee in Parliament, Honourable Sandile Ngumalo, thanked the Office of the Prime Minister for the support. Ngumalo said they looked at strategic analysis internally and externally, and they noted what is expected of them by stakeholders.
The Parliament of Swaziland is the first one to develop an HIV/AIDS strategic plan, and we are proud of that because it shows political commitment.
Tim Rabuhamba, who spoke on behalf of the UN country representative, praised the move by Parliament of coming up with a strategic plan, which he said shows the legislature's commitment to the realization of His Majesty's declaration of an AIDS-free Swaziland by 2022. The Secretary General of the SADC Parliamentary Forum, Dr. Isa Uchivia, said the Swaziland Parliament Strategic Plan on HIV and AIDS is part of the SADC initiative to end HIV and AIDS in the context of regional, continental and international agreements, and that Southern Africa must take a lead in the global efforts to end AIDS, as it is one of the hardest hit regions globally by the pandemic. Sibusiso Ngubane, Swazi TV News, Zulwini.